Hi there, I'm Rowland Rees. I'm a consultant urologist and andrologist working in Southampton and in London in the UK. And I specialise in andrology and male genito-urethral surgery. Well, Peyronie's disease is essentially a condition of penile scarring. It's the deposition of something called fibrosis, which is a medical term for scar tissue, along the side of the chambers of the penis, and that results in a lack of elasticity and stretchability that then can lead to penile curvatures on erection, where the remainder, the healthy part of the penis, stretches normally, but the Peyronie's plaque it does not stretch as much, and therefore you end up with an indentation or curvature, shortening, etc. So the causes of Peyronie's disease are less well defined. We certainly know that what we see in Peyronie's disease, where there's scar tissue formation, that it's very similar to men where there's been a penile fracture or penile injury in the past. So one of the theories is there is some very minor trauma, and as men get older, or their tendency to wound healing is less good, that you develop an inflammatory phase where there's a very small injury to maybe a bruise or something within the penis that then becomes very inflamed, and that inflammatory process, the inflammatory phase, leads to scar tissue formation over a period of 6 to 12 months. So if we leave Peyronie's disease, and there are many studies looking at the natural history of Peyronie's, then there is in some cases some healing that occurs. So the lump or the plaque may get smaller. Sometimes the curvature will improve as well, although that can sometimes be due to progression of the disease. So scar tissue, for instance, on both sides would then cancel each other out and straighten out the curvature. So there is improvement. There can be improvement in symptoms in a small proportion of patients, and of course it depends on when you go to the doctor, when you notice your symptoms, as to what will happen. But essentially, it can take 6 to 12 months to evolve and reach a plateau. And during those 12 months, things actually can stay the same, or get better, or get worse. It really does depend on which phase you're in and how bad, how badly affected you are by the Peyronie's. There are a number of ways of treating Peyronie's disease, and quite simply, if the symptoms are mild, for instance, a curvature is less than 20 degrees, the pain's gone away, then it's very reasonable just to do nothing and just to manage it conservatively, and maybe no treatment is necessary. People have tried all sorts of medications over the years, and in a nutshell, there aren't any good medications or tablets that can be taken that will resolve Peyronie's or will essentially get rid of scar tissue. That treatment doesn't exist. Next, we've got injection therapy. There are some injections available in some parts of the world, such as collagenase or Xiapex, interferon, verapamil, but none of these treatments are, dare I say, wonder cures. They work in some people but not others, and particularly in the case of collagenase, can be very expensive, and therefore the cost effectiveness of these medications or these injection therapies are not so good. The mainstay of treatment, certainly in my practice, would be either mechanical therapy or so-called traction therapy, which is very simple, using either a vacuum device or a penile stretcher, which carries very little risk whatsoever, or surgery. And surgery remains really the mainstay of treatment for Peyronie's disease. 3 types of operation generally: something called a Nesbit procedure, or the Lou procedure, which is a grafting procedure, or ultimately a penile prosthesis if the Peyronie's is particularly severe or associated with erectile dysfunction. So the surgical options for Peyronie's disease are important to discuss, because ultimately most people having treatment will end up having some form of surgery if they want treatment at all that is effective. And there's certainly it's certainly the most effective treatment. The first option we have is classically called a Nesbitt procedure or corporoplasty, where the convex side, the longer side, the healthy side of the penis is operated on. It's shortened either by removing a little bit of tissue and stitching the edges together, or by plication, which is merely to put a stitch or a suture into it to pull it shorter. And that, therefore, by definition, will shorten the penis, or to put it more accurately, it'll shorten the healthy side of the penis to match the affected side, or the shorter concave side. So the new penile length as a result of that operation will be the same length as the side that's affected by the curvature. But having said that, it has a very low complication profile. It's a very effective procedure, high success rate, and a very low reoperation rate, and therefore, as such, it's a good operation. It's an effective treatment. It's durable, with a low complication rate, and generally a high success rate in the long term. It doesn't tend to affect erectile function directly, certainly not on a physical basis, and generally patient outcomes and satisfaction high. The alternative, and certainly if the curvature becomes very severe, and most urologists, I think, will use 60 degrees as a cutoff, where we need to start thinking about alternative approaches, such as the incision and grafting or the Lou procedure. And sometimes that is necessary, but it does necessitate very good erectile function, because this operation has a higher complication rate. Approximately 25 to 30% of men having that operation will have some sort of problem post-operative, either another curvature or erectile dysfunction that may need treatment. So it's important for men who are being selected for this incision and grafting procedure that they have good preoperative erectile function. And thirdly, if they have severe Peyronie's disease, severe curvature, and erectile dysfunction, then we are heading towards a penile prosthesis or penile implant, which is a third option. And that is a very effective treatment, again, in that setting, but usually reserved for men with a combination of severe deformity and erectile problems. So Peyronie's has a big impact on quality of life. First of all, obviously, the obvious factors are on sexual functioning. So a penile curvature or penile pain or erectile dysfunction can all have an impact on a man's ability to have sexual intercourse, and therefore on their relationship and their life in general. Secondly, we see quite high rates of psychological morbidity, particularly depression, associated with Peyronie's disease. Is demasculinizing. It has a significant impact on psychological state, and that can make treatment and progress through the disease quite a challenge, particularly for the patient and the doctor. And it's important, therefore, to look at all aspects of this, not just the penis, but also the whole body, the whole patient, including their mind. So it's an important thing to treat this holistically, really. So preventing Peyronie's disease is certainly difficult. We need to look back at the causes, and we've talked about trauma. So obviously avoiding trauma or minimizing trauma will minimize the risk of any injury or scarring to the penis. And beyond that, we then look at risk factors for Peyronie's disease. And it's quite well established now that there are vascular risk factors, such as the metabolic syndrome, which is a collection of obesity, diabetes, dyslipidemia, or problems with your body fats, high blood pressure, and those sort of things. So those are the risk factors, and men with those conditions are much more likely, particularly diabetes, much more likely to develop Peyronie's disease. Having said that, there is no direct evidence that modifying all of these reduces the risk, but that certainly tells us a little bit about what's going on in this condition.